Well, in Louisiana, a law recently passed means that you might see a little more interaction with a physician's assistant rather than a doctor or a nurse practitioner in certain situations. To explain a little more about that law today and just what a physician assistant is, not a term you normally hear every day, we are joined by Gail Curtis, president of the American Academy of Physician Assistants, who was in town this week to speak with the Louisiana Academy of PA's annual conference. Gail, good morning.
Good morning, Jeremy, and thank you so much for having me on the show today.
Well, you're welcome. Let's talk a little bit about physician assistants. As I said, not a term you normally hear front and center. When you think of healthcare, you think of doctors and nurses or things of that nature. What is a physician assistant, and how are they part of that process?
Well, first of all, I think a lot of people do think of PAs now as part of the healthcare team. We have been around for 50 years. In fact, this year is the 50th anniversary of the PA profession. And so we're grateful always to be able to put ourselves out there and let people learn a little bit more about us. But we're a little bit more out there than 50 years ago, for sure. And PAs are state licensed medical professionals, and we practice medicine on healthcare teams with physicians and other providers. We practice in all 50 states, and we're able to prescribe medicine in all of those 50 states. We've gone from being 50 years ago a profession that was created at Duke University in North Carolina to provide an opportunity for Navy corpsmen who were coming back from service to be able to transition and use the medical skills that they had in civilian life. And so that sort of formed this entire new profession. The goal then and the goal now was to improve patient care and to help address the huge shortage of clinical health care providers that existed then. And as you're probably aware, we're seeing shortages of health care providers even today. We only had 3 PAs in 1967, but now we have more than 115,000 throughout the United States. We only had that one program at Duke to begin with, but now we have really over 200 programs across the country, and we're going to be graduating about 10,000 new PAs every year.
So let's talk about the graduating process. How does one kind of start on the road of becoming a PA? Do they go to medical school, or is there another track for that?
That's a great question. So PAs, like anybody who's going into a pre-medical career, have to go to college and get their Bachelor of Science degree, and then they go to PA school, which is anywhere from a 2 to 3 year program, which educates PAs in medicine, surgery, pharmacology, examination skills, and prepares them to go out and work as a generalist medical provider.
Do PAs have a title, like a PhD or something something that kind of identifies them as a PA?
Yes.
Is it PA?
Yes. Yes. You graduate with a master's degree, and it has various names across the country. Probably one of the most common is a Master of Medical Science.
Do PAs work in a hospital? Are they independent contractors who team up with a hospital? How do they kind of end up in the healthcare, where they end up working? Because it sounds like they work in a number of different fields of healthcare. It's not just one narrow frame.
That's absolutely right, Jeremy. They work in every medical specialty that exists. And the way that happens is we're licensed through the state medical board. Well, first of all, once everybody finishes school, you take a national certifying exam, which is a rigorous exam on core medical issues. And then once you're certified, then you can apply for a license in any of the 50 states. And then you go to work on teams. You work with physicians on teams, and really what a PA does on that team is determined at the practice level. So whatever the need is, we're able to fill that need.
And can a PA be trained in multiple areas, or do most PAs find themselves focusing on one particular area once they kind of get an area of expertise they're interested in?
That's a great question. It's interesting. PAs are trained as generalists, what you might consider like a general practitioner. Once they graduate, they can go to work in any specialty, and then as they are in a specialty, of course, they gain knowledge in that specialty. So we graduate PAs with a certain level of education at the master's level, and then through their experience, they might become experts in any specialty area. It could be anything from dermatology to cardiology, just depends on what their interest area is.
Is there an additional level of certification needed there, or is it just like you list on a resume your skill set? You know, I'm PA and I've had 10 years experience in dermatology, for example.
That's correct. It's much like you're getting an on-the-job internship in whatever specialty you go into. So there is no requirement for further education, but certainly everyone gets lots more experience, and then we also are lifelong learners and are always participating in continuing medical education, which is a requirement to practice.
So let's say that I have to go in for medical treatment. What part of the process would I normally encounter a PA as opposed to a doctor or a nurse practitioner?
It really depends on the practice that you're seeing, but you could see them as your initial provider. They could provide all of the care at that visit, and you would leave having seen just the PA. If it's a surgical specialty, you would likely see the PA first and then meet with the surgeon, although PAs can be involved in assisting in surgery. It just really depends.
So you've been speaking this week with people at the Louisiana Academy of PA's annual conference down in New Orleans. What are you hearing from PAs on the ground in Louisiana in terms of what needs are being met and what areas might be shored up a bit?
So first of all, it's a great conference, and in Louisiana you have over 1,000 PAs. The majority of them do work in physicians' offices and clinics, although one of the more popular specialties in Louisiana is the surgical subspecialties. And what I've been hearing about at the conference is that Louisiana legislature recently passed a law giving PAs who have examined a person who is experiencing a mental health or substance abuse crisis the legal authority to order transport of that patient to a treatment facility. And this was really a great win for the patients and population of Louisiana, because previously only a physician, a psychiatric mental health nurse practitioner, or a psychologist could do this. So this really increases access to care and really makes it much better for the citizens of Louisiana to be able to get the care they need right when it's needed.
What does that difference in that ability to get help to someone faster? I mean, we hate to use the word red tape, but there's that you don't need that other layer of approval to get someone help they need. What's the difference? What kind of difference is that going to make in terms of getting that access to care quicker for someone who needs it?
Well, I think this is one of the things that AAPA is really focused on this year, and that is 50 years ago when this profession was created, we were a new provider and nobody knew exactly how we were going to fit into the healthcare team and what were our abilities going to be. 50 years later, there's study after study that shows that PAs provide wonderful, competent health care to patients, and that practices that employ PAs have much better outcomes and access for their patients to care. So what we're really focused on is trying to eliminate any of these bureaucratic paperwork burdens that really just get in the way of patients getting the care that they need. So by this new law that was passed in Louisiana this year, which was SB 216, if you have somebody who's in a crisis, the PA doesn't have to stop and go and find a physician or another provider to take care of getting this patient the health care that they need right then. The PA can act on that and get that person to the correct facility and to the correct health care that they need right then. So it just takes away one unnecessary burden that slows down the health care to patients.
So what else are you learning from the PAs in Louisiana? Obviously, it sounds like they're happy that this law was passed. Are there any other concerns or things to kind of let people know about for Louisiana PAs that you think people should know about?
Well, I think that the Louisiana PAs have worked really hard over the past year to have a few other of these administrative hurdles removed, and so PAs in Louisiana can now prescribe controlled substances to their patients, whereas before they were not able to do that. They are able to work at their practice level to decide, hey, what's needed in our practice? Let the physician and the PA and the other members of the team sit down and say, how do we want things to work here, rather than having to ask the state, how can we do this? And so I think that has been a big improvement. They also had a change in the number of PAs that can work with a physician. Before, a physician was only allowed to work with 2 PAs. Now they can work with 4 PAs. And they also have the ability to really focus the health care of their patients at the practice level, where, let's face it, that's where I know my patients best, the physician knows those patients best, and this is really what we want for the patients of Louisiana. So they're very excited about these changes that they have been able to accomplish over the past year, because what I hear from all of them is that all they really want to do is just be able to take good care of their patients.
Talking with Gail Curtis, President and Chair of the Board of the American Academy of PAs, the AAPA. She's in town, or she was in town this week for the Louisiana Academy of PA's annual conference. The whole AAPA is coming down to Louisiana next year. It's celebrating its 50th anniversary this year. So what does the next 50 years for the AAPA look like?
Well, I think it's an exciting time for the AAPA and for PAs across the country, and also for patients, because as I've been saying, we really are focused on being able to provide the best health care to patients. One of the things that's exciting this year for the AAPA is we continue to try to work in every state and on the federal level to modernize PA practice laws so that PAs can practice at the top of their education and experience and provide this health care. We try to work hand in glove with state chapters when they come across things that they are trying to work on in their specific state, and that varies from state to state what it could be. One of the things that we're working on this year is something called optimal team practice, because PAs really are absolutely dedicated to working in medical teams. But as I said, we're trying to eliminate these unnecessary paperwork things, so we're focusing on maybe not having a specific relationship with one physician in order to practice, rather let that be determined at the practice level. We hope to have more PA medical boards across the country, or the medical boards that control medical care in a state, to have PAs as part of that board, and physicians that have practiced with PAs on that board. One other thing that we're looking at is trying to be sure that PAs can be directly reimbursed by all public and private payers. And that's because right now in many states, the work that a PA does is billed under the name of a physician. So when you go to try to show people the good work that PAs have done and the impact that they're having, it's hard to track that. They are sort of hidden providers. So we're focusing on that as well. So lots of things. I think it's a great time to be a PA. It's becoming a very well-respected profession, and there are lots of jobs for PAs when they graduate from their master's program. And I think when you interview patients, you find that 93% of patients that state that they really like seeing their PA and really feel that they are getting excellent care from their PA.
And we are also in the middle of PA Week. How did that come about?
Well, Jeremy, the father of the PA profession, Dr. Eugene Stead at Duke University. That happened to be his birthday, but it also was the date when all of the official legislation was signed to allow the profession to exist. So this is PA Week, and it's a week that we celebrate the PA profession around the country. So I wanted to just take a moment to say happy PA Week to all the PA colleagues out there that might be listening today. And if you want more information about that, you can go to our website or hashtag @PAWeek.
We've been speaking this morning with Gail Curtis, President and Chair of the Board of the AAPA. Thanks for joining us today. Of Interest to You is a production of iHeartRadio, Baton Rouge.